Hello, my name is Julie Hebert. I'm with Jim Hall Insurance, and I'm here to review your employee benefits guide for the 2020-21 year. Of course, things are a little different this year as they are everywhere. We're going through this employee announcement as we would normally do at an employee meeting. Hopefully, I'll be able to shed some light on your benefits, answer any questions that you might have, and if not, please feel free to contact me. My contact information is right here, Julie Hebert. My email and phone number, I'm right here in Liberty. Jim Hall is my partner. Here's his email and phone number, and he'd be happy to assist as well. We're going to go through your benefits, and we're going to talk about each of these plans in more detail. But just to briefly give you a highlight, your medical insurance this year is with National General Benefit Solutions. You have a $1,500 deductible this year. You're going to continue your dental and vision coverage with Cigna, Cigna Dental, Cigna Vision, and continue the life insurance with the Mutual of Omaha. 2 times your annual salary is your coverage there, and also coverage for your dependents, your wife, your spouses, and your children. Cost of coverage. The City of Liberty pays 100% of your employee life, medical, dental, and vision coverage, and 60% of your dependents coverage. Here's the cost per pay period listed below, depending on who you elect to cover. Here's some information. We use a lot of terminology in insurance. This might be helpful if you're unsure what any of these terms mean. Open enrollment. Open enrollment is going on right now in the month of September. This is your time to make changes to your coverage, who you want to cover and what you want to cover them for. For any reason, you can make changes right now. You can add or delete any eligible dependents yourself from any of the coverages. If you previously declined to enroll yourself, this is a time where you can include yourself or a dependent if you need to. You can cover your children up to age 26 and a lawful spouse at any time. All open enrollment changes are effective October 1st, 2020. During the year, you can add yourself if a special event occurs, if you don't currently cover yourself and you need to, or your spouse or your children. If you have a change in employment status, adoption, marriage, death, or divorce. Anytime this happens, you need to notify Jody Bahunko over at the City Hall within 30 days to make a change so that we can get that processed for you. If you're a new employee, you have coverage the first full month after 60 days of employment. So if you start October the 15th, you'll have to wait all of the rest of October, November, December, and January 1st would be your first day of coverage. The medical insurance, as I mentioned, is now going to be offered through National General Benefit Solutions. We're going to go through some of the details of your coverage, and then we will talk a little bit about how the program works in more detail. You have a $1,500 deductible per person, a $3,000 deductible per family, which is a $500 reduction in your deductible compared to last year. Your coinsurance continues at 80%. So this means once you've met your $1,500 deductible, you're going to pay 20% of your medical cost up to $7,150 per person, or a combined $14,300 for your family. If you have to go to an urgent care facility, it's $75. You go to the emergency room, it's a $25 copay. Primary care type doctor visit is $20. Specialist is $35. You do not need a referral to go to a specialist. There's no charge for the Teladoc virtual visits. Preventative care is covered at 100%. Any diagnostic lab testing or imaging or CT scans is covered at 100% with your doctor copay. Inpatient hospital care is covered at your deductible and 20%. Outpatient care is covered at your deductible and 20% up to your maximum out of pocket. Your pharmacy provider is Cigna, and they have a retail copay on your pharmacy prescriptions. Generic drugs are $15, brand name drugs are $45, specialty drugs are $60. So here's some information from National General about how your plan works, about your pharmacy benefits, how to read your EOB, and how to look at your member portal, the Teladoc program, and a wellness program by Vitality. So National General is a little bit different. There are no networks with National General. The way this program works is if the doctor accepts Medicare, which most doctors do, they are reimbursed at a rate based off of the basic Medicare reimbursement rate. So it means that you can go to any provider that you want. So the first thing you do right here is step number one, you seek your medical care. You go to the doctor or the hospital and you simply show them your medical ID card. If they have any questions, they can call the customer service number or you can call on the back of your card. After you've paid your copay, so say you're going to just a primary care doctor, it's going to be a $20 copay. After that is processed, you'll receive an explanation of benefits showing what your portion of the cost is, which if it's just a doctor visit should be the $20. And then you can review your bill when you get that from the provider. And if there's any discrepancy in that, you can call this 800 number, important number, it'll be on the back of your card. And then if you're unable to resolve that, then the team goes to work and they can contact the provider and settle any discrepancies in the bills. So it's very important to know about this member advocacy program. They can answer your questions about billing. They can clarify your explanation of benefits. They can help you find providers and help you understand your benefits. So that number will be on the back of your card, but an important number to know. Your pharmacy benefits are provided through Cigna. There is a website and an app through the mycigna.com. It can tell you what medications are covered. It can give you the drug cost tool. If you take something that's unusual, you might want to look into that. There's also a toll-free number on the back of your ID card that you can call if you have questions. This talks about how you can get a 90-day supply of your drug, which will be less expensive. And then you can get help with specialty medications on item number 5 there. Now this right here talks about how to read your explanation of benefits. Your insurance is through National General, and Allied Benefit Systems Incorporated is who your explanation of benefits and your card is going to come through and all your portal information. So this is what you're going to receive after you go to the doctor. It's going to show you the date of service when you had the procedure or the testing or the doctor's appointment. It's going to show you the amount billed by the provider, the amount that the plan paid, and then what you may owe. And then you need to compare this to what you actually paid and what the doctor's office is billing you. If you have any uncertainty about what you owe, you can look here, patient's responsibility. You can feel free to call that 800 number and get the member advocacy program team to assist you if you have any questions or problems. The Allied Member Portal is where you can access your ID card. This is how you look at your benefits online, and you can manage a lot of information about your medical coverage. You can look at you can access your ID card. You can review your personal health records. You can get questions to your benefit, answers to your benefit questions, and you can review your claim history. All on this website. This tells you how to register and how to log in. Teladoc is available 24 hours a day, 7 days a week, and you're able to speak to a board-certified doctor in the state of Texas, and you're able to go to teladoc.com and download the app, or you can go online and set up an account, or you can call this number right here. You provide your medical history with a brief overview of what other medications you might take in your current medical situation. Then you can request a consultation and a doctor can call you back. I highly recommend this service. I've used it a lot of times, especially with my kids. It seems like somebody was always getting sick when they were younger on a Friday afternoon or a Saturday morning. The great thing about this is that you can go over your symptoms and let them know what you think is wrong. They can give you a diagnosis and call in a prescription for you right over through the telephone, and you don't have to go to a doctor's office. But they cover common situations like cold and flu, allergies, ear infections, sinus problems, and more, anytime, any day, anywhere. So that's the great thing about this. The National General Benefit Solutions Program also has a Vitality Health program where you can log on to the powerofvitality.com. Once you get your ID card, you can log in and it will help you assess your current health situation, give you recommendations to become more healthy, and you have the option to follow their program, and you can get a $25 Amazon gift card, and you can also earn points to shop in the Vitality Mall, which you can buy things that are similar to items on Amazon, books and electronics and things. So it's a really interesting program. It's free to you. It gives you some great pointers on losing weight, getting in better shape, and how to improve your health. Life insurance. The City of Liberty generously offers for their employees life insurance up to 2 times their annual basic salary. This benefit also includes an accidental death and dismemberment coverage that would double your payment if you were to be killed in an accident. And there is a reduction in the amount based on your age here. One thing that's very important is that you name your beneficiaries and you keep that information up to date at all times. If something happens, we want to make sure that we have the correct person to pay on file. We do recommend that you name a trusted individual or a spouse or a parent rather than a minor child, because that can create some legal issues. So please consider naming someone other than your children as your beneficiary. Retirees, and once you retire from the city, they offer a $5,000 life insurance policy that will cover you after retirement. Your dependents are eligible for your spouse for a $5,000 coverage and $2,000 for your children up to age 26. Let's see. There are quite a few other benefits that are available to you. You can receive a 15% discount from the LASIK vision correction through National LASIK Network. That's through your vision insurance. There's an employee assistance program, a hearing discount program, travel assistance, identity theft, and will preparation. So let's go through some of those things. And these are all provided through the Mutual of Omaha through the benefit that you have on your life insurance. So the basic employee assistance program is help for you. It has some emotional kind of personal support for emotional well-being, family and relationships, legal and financial, and health and lifestyles. You have unlimited telephone access to these professionals 24 hours a day, where you can call and get referrals or ask for help. They will give you legal assistance and financial planning services with online will preparation, a legal library, and online forms, and financial consultation. So here's the 800 number and the website to visit for those items. There's a hearing discount program where this can help you with hearing aids and hearing solutions. So here's the 800 number for that. You're eligible to participate in. Identity theft. If you are the victim of identity theft, you can call this number and they can help you by getting in touch with fraud departments at your bank and credit card companies. They can assist you in filing with the credit bureau so that you're not, your credit report's not impacted by that incident. And they can help you with other filing requirements. So here's the number for that if you have identity theft issues. This is a program offered to you from Mutual of Omaha that's a worldwide travel assistance. And all these programs are completely free to you because you're a City of Liberty employee. They will help you with pre-trip assistance and any emergencies you have while you're traveling. They can help you with document replacement, like if you get your wallet stolen, they can help you try to get identification and proper ticketing and things for your airline tickets. They can also help you with medical assistance if you have a medical emergency while you're traveling. This is the 800 number. I encourage you to put that in your phone and have it with you whenever you travel, and see if they can't help you if you have an emergency. Will preparation. There's the website here for www.willing.com, Mutual of Omaha. You answer a few simple questions and they will give you a will preparation packet that will help you prepare a will. We encourage everyone to have a will and be prepared for the things that will happen to all of us one day. To go over your dental benefits, your dental benefits are offered through Cigna Dental. It's a very nice dental program that you have. You can have 100% coverage on preventative services. So twice a year, you can go get your teeth cleaned and get x-rays. So we encourage you to have this done at least twice a year, that's 100% covered in your plan. You don't even have to pay a deductible to go and use those services. If you do have to have a filling or an extraction or endodontics or any of those items, those would be considered paid at 80%. So you would pay 20% after a $50 deductible. Major services like surgical extractions, oral surgery, and bridges are covered at 50%, and you again would have to have a $50 deductible. You have a $2,000 maximum annual benefit. You also have childhood orthodontia coverage up to $3,000 of a lifetime benefit. So that's a really nice benefit to have for your children. Here's some information on your Cigna DPO. So you have kind of like a PPO, but a dental PPO. And this is some information about your dental plan, the number to call if you have a question for Cigna. Here's some frequently asked questions about your dental plan. Can I go to any dentist? Yes, you can. You typically spend less when you go to a dentist that's in the Cigna network, but you can go to any dentist. You're not required to sign up for like a primary dentist. You can just go to whoever you want. And typically, dental providers are going to file the claim and then send you a bill for what the balance is. And here's some information about if you're not sure which dentist to go to, the My Cigna directory will help you pick a dentist that's in the network. And so there's some more information about the mycigna.com where you can get access to more information online. Here's the full details of your coverage. You need to look at that. Your vision benefits are also provided through Cigna. You have a $10 copay to have an annual eye exam. To get your glasses, it's going to be a $10 copay for your lenses, whether they're single vision, bifocal, trifocal, whatever you might need. You can get frames every 2 years with a $150 frame allowance. You can get contacts instead of glasses you have a $150 retail allowance there. You can get your eyes checked once a year, get lenses once a year, and every other year you get new frames. So that's the information on that. Here's some more information about Cigna Vision, what the coverage includes, in-network versus out-of-network, finding an eye doctor. Here's the information on the mycigna.com. And again, the really specific details about what's covered in your plan. COBRA, if you are no longer employed by the City of Liberty and you want to continue your coverage with the City of Liberty, this is the monthly premium for each level of coverage. You would need to notify Jody when you depart from the city that you want to continue the COBRA coverage, and she can do that for you. This talks about Medicare coverage and your health insurance. This year we're doing an online enrollment program called Ease HR. You'll receive an email, or already have received an email from me that will allow you to log in and manage your enrollment. It's when you get the email, you click the blue button at the bottom, you manage the enrollment, and you start the process. It's a very simple click. The process, you're going to have a screen like this to your left. You're going to put in all your personal information, your dependents, what benefits you want to choose. It's a checkbox or an X box next to your name and your dependents, whether you want to cover that person or not. Then at the bottom of each screen, there'll be a blue button that says continue. When you get to the end, it'll show you a summary of what's coming out of your paycheck, and then you will actually sign the forms. You'll sign it with your mouse and with your typing in your name. And then when you get to the end, you have a screen that says you have completed, and you'll get an email from Ease that has all your documents in it. This is a quick and easy way to do the enrollment, especially in this COVID environment with things so crazy and difficult to get in front of you guys personally. I want to encourage you to review all this. If you have any questions at all, please give me a call or an email, and I'm right here in town. You're more than welcome to stop by our office at 1806 North Travis. We're happy to help you. Stephen is also works with Jim and I, and we all are here together to serve you and try to give you the best benefits possible. Thank you so much.